everybody, today we'll be learning about pancreas injury scale in pancreatic trauma according to American Association for Surgery of Trauma. There are 5 grades. So proximal pancreas is defined as a gland to the right of the superior mesenteric vein and portal vein axis. The one which is to the right of the superior mesenteric vein and portal vein axis is the proximal pancreas. Distal pancreas is the one to the left of the axis. The term deep refers to an injury down to the level of the duct. Superficial implies to the injury superficial to the duct. What is a pancreatic contusion? It's an indistinct region of pancreatic edema. Laceration is a discrete linear or branching partial thickness tear. Pancreatic transection is a full thickness tear. Pancreatic fracture or comminution, which is shattered pancreas. And we have others like pancreatic hematoma, pancreatic pseudocyst. Grading of pancreas. Pancreatic trauma. First one is grade 1. It has an hematoma, laceration. Hematoma, this is the pancreas. We have a pancreatic duct and we have a bile duct. They open into a duodenum with a major papilla. Hematoma, it's a minor contusion without any duct injury. Laceration is a superficial laceration. It does not extend up to the duct. Superficial laceration without duct injury. That is grade 1. Grade 2. If we have an hematoma laceration, hematoma it's a major contusion without duct injury or tissue loss. Laceration, it's a major laceration without duct injury or tissue loss. Grade 3. Grade 3 we have parenchymal injury with duct injury. Laceration we have distal transection is a complete full thickness tear. The one to the left of the superior mesenteric vein and portal vein axis is the distal part of the pancreas. Grade 4. We have proximal transection and we have parenchymal injury involving the ampulla. Then we have grade 5. It's a massive disruption of the pancreatic head. This is the head region, is a massive disruption of the pancreatic head. That is grade 5. So CT is the initial modality of choice. We do arterial and portal venous phase. What are the direct signs? We have enlargement of the pancreas with heterogeneous parenchymal enhancement. We have a pseudocyst or abscess communicating with the duct. We have an hematoma or fluid collection. We have a laceration which can be superficial or deep. We have a transaction, full thickness tear. That's called pancreatic fracture. These are all direct signs. We have peripancreatic fat stranding, fluid or hematoma between the pancreas and the splenic vein. We have thickening of the anterior pararenal fascia, that is gyratops fascia, peripancreatic retroperitoneal fluid, intraperitoneal fluid, especially in the lesser sac, adjacent injuries involving the spleen, liver, biliary and duodenum. MRCP. Next, we have imaging modality of choice for pancreatic duct, any injury or associated injury. Complications of pancreatic trauma, we have pancreatitis, fistula, abscess or sepsis. Most common with pancreatic duct disruption, hemorrhage from pancreas or pseudoaneurysm, splenic or gastroduodenal artery will be involved, pancreatic pseudocyst formation. These are all the complications of pancreatic trauma. Thank you.